Welcome back. My name is Sandra and I'm an occupational therapist, which means my job is often to get people to do something they don't want to do. I work both in acute and inpatient rehab settings. And when it comes to motivating clients or building a relationship with them, having good rapport is crucial for them to both participate fully in therapy and get the most out of my time with them. Even when someone is motivated maybe to get up and move, they aren't necessarily motivated to do the things that I'm asking them to do, like get on and off the toilet or take their socks on and off. Those are important assessment tools that tell me a lot about their functional abilities. So if I can get someone to trust me and to trust me quickly, it can motivate them to participate, improve their compliance with my recommendations, and just overall improve their experience with me. It also makes my job more fun because typically if people like you, then they're nice to you. I think that one of my skills is my ability to build rapport with people quickly, so I have compiled 5 tangible tips that you can use to do the same thing. My first tip is to explain your role and your goal for them as soon as you meet. And this is specific. I hear a lot of, hey, I'm with therapy and the doctor ordered us so that you can get up and move. That's not motivating to a person at all. In fact, you're not even there because you want to be. You're there because someone else told you to be. And while that phrasing is a really easy one to go for, it can be one that loses rapport straight off the bat. I prefer to use something that is a little bit more specific to them. So if I'm in the acute care setting, I'd say something like, I'm an occupational therapist. My role here is to make sure that you can do the things you need to do in order to take care of yourself so that we can have an understanding of how you would manage at home. When people understand what you're there for and why it matters to them, it makes them a lot more motivated to do what you want, even if it might sound silly. Another tip is to compliment them genuinely. I don't like to do this off the bat because it can come off as you're buttering someone up, and really building rapport is just buttering someone up, but I don't like to make it obvious that that's what I'm doing. I also do genuinely care about the people that I'm with, so if I can find something that I really like about them, whether it's a personality trait, maybe they're funny, or they have really pretty eyes, or they're wearing a specific piece of jewelry that's beautiful, or their kids are very nice. People love to be told that their kids are really nice. I like to sneak that in, especially right before I ask them to do something that might be a little challenging, like standing up from the bed for the first time. But I try to find something that I genuinely think is true and not just compliment them to compliment them. Usually if you tell someone something that you like about them, it makes them feel nice, and people remember the way that you make them feel. If you make them feel nice, then they likely like you a little bit more. The whole world just moves a little bit smoother. So that's just a little bit of psychology. Tip number 3 is to go out of your way to do something for them. Maybe before you start, you notice that their water's empty and you say, I'll just go grab that real quick, and you do that, or you grab them a warm blanket at the end. Just go out of your way to do something for them that's nice. Along with this tip, if you happen to be a therapist or a CNA or someone that has to do something that maybe the person doesn't love doing, maybe you're placing an IV or you're doing therapy, you can ask, what's something that we could do for you right now? Those people haven't brushed their teeth in days, they haven't washed their face. Go out of your way to take an extra 5 minutes to help them do that. That helps them just feel a little fresher and more human. A storm is brewing outside. Another great way to build rapport while you're actually participating in a session with someone or doing something with them is to explain what you're doing and give the research behind why it's important, or give the reasoning to it. So if you're placing an IV and they already have one and they're like, what the heck, why are we doing this? Be like, IVs are known to fail. We want to make sure we have access, yada, 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 whatever. I'm not a nurse. That's just like my understanding of why some people have two. Especially on rehab, when I have a longer session with someone and we're doing something that they might think is a little silly, I love to pull out the research shows, yada, yada, yada. I'm a young gal with a young face, and some people don't always realize there's a method to the madness. They don't trust me. They don't think we're doing something that's significant with them. So when I just explain the why behind why we're doing something, they instantly trust you more, and it validates your reasoning. It's also like important for people to be educated in their care, so explaining the why is really important. So I'll pull out like I'm asking you to stack these blocks because we're working on a specific grasp, reach, release pattern, and when it comes to neuromuscular re-education, all the research shows that repetition is one of the most important factors. So we're gonna do this 20 times, but it relates to like how you reach and grab your toothpaste or how you put away dishes. So that's kind of why we're doing this. And especially when you're able to put into how it impacts them and their life, boom, they trust you. And the last tip is one that I pull out especially with my maybe less excited about therapy patients, and that is that everybody loves to be praised for hard work, so be their biggest cheerleader. I mean, this works with everyone really appreciates it, but you know the kind of patient I'm talking about, the one that's like, I don't want to do that, that's too hard, I'm tired. If they're difficult to motivate, then motivate them along the way. So if they do, even if they do something simple like get to the edge of the bed, just pull out like, man, you just had a major surgery, that was really hard, I'm really proud of you, you handled it really well, let's take a break and then do the next thing. I guess this is kind of a bonus tip, but also validate that it was challenging while you're doing that. And don't talk to them like they're a child unless they are a child, then that's appropriate. But if you're speaking to an adult, treat them like an adult, but praise them for their hard work. I have had many difficult to motivate patients that a little bit of praise goes along with, and they just like to feel important. And if you tell them that they're doing something that's hard, but they're doing it really well, they feel a little bit more important. Those are some of the things that I know that I tangibly do with the goal of building rapport with my patients. I really like people. It's part of the reason that I got in the job. It's important to make your patient feel like you're present with them and care about their well-being beyond just the fact that you're like caring for them within the healthcare system. So anything that you're skilled at doing that ultimately leads to that goal will help to build rapport. And at the end of the day, building rapport makes your job easier and it makes their experience better. So it's worth spending a little extra time and energy putting the effort into it, because at the end of the day, they'll get better dividends from the investment. Don't forget to subscribe. It really supports my channel. I love having you all here. I'm so excited about where we're going, and I'll see you guys in the next one.